Hi, my name is Rob Allen. I'm the CEO here at Sitka Community Hospital, and I'm today going to provide a little more background information on the letter that is attached to this email that you just received. This is a copy of the letter that went to the assembly from Sitka Community Hospital and Search from myself and Chuck Clement, the CEO at Search. And it's just information on the ongoing collaboration talks, the project that has been going on for several months. I've given updates in the past on this at managers' meetings, at all staffs, and I've also included this is the letter number 3. I've included the other 2 letters as well. And I talked about it a little bit in the September letter to all staff. So in this letter, it was also reported in the paper this week, so this is kind of timely to give you a little more background. And what is happening is we have reviewed a document from the consultant, ECG, that kind of lays out the 3 different options that they have been talking about and discussing and sharing information with us over the past several months. In the past, I've talked about this as well. First option they looked at is just status quo, not doing anything. Search and Sitka Community Hospital continue to compete for patients and continue operating business as usual. Number 2 is to look at some selective and coordinated collaboration options. An example of this would be forming some type of joint operating agreement and cooperating on something like the OB program and some of our clinics, and cooperating on bringing in specialists as well, specialty type clinics. It would be more limited in cooperation and fairly complex to put together. There would be some benefits to that, but it's something that needs to be further evaluated, but is not something that the consultant is recommending. They're recommending the number 3 option, which we are calling selective and coordinated collaboration. Now, just as a little background, one of the projects we worked on early on with the consultant and Search as we started this talks was to try to set some base areas that we agreed upon, and we worked upon values and goals, the things that were both important to both sides, that both sides could agree upon, that would help us evaluate suggestions and programs that were brought up by the consultants. So this happened early on in the process, and I did want to share those values and goals with you, just so you would be familiar with what was kind of underlying our thought process and decisions and how we evaluated these different options. So the values, number 1 was to ensure equal access to care for all patients. So that was very important that Sitka Community Hospital and Search, of course, have different missions. Search, one of their main missions is providing healthcare to their beneficiaries, and Sitka Community's mission, includes all of the citizens of Sitka, providing care for. And we wanted, in anything that moves forward, that is very important. That whatever comes of this ensures equal access to care for everyone in Sitka. Number 2 was to provide services tailored to the needs of patients and the community. One of the things that we're looking to do is to try to improve the options for care in the community and try to get more people to stay in Sitka for their services. And so that was one of the values that we thought was important. Provide high quality, culturally appropriate care for our community. And then the last one was to ensure equitable employment opportunities. This was also felt to be important, and of course a concern that's been expressed by quite a few of the staff here at Sitka Community Hospital. Is in the past, Search has had a reputation for their hiring standards being driven by the Native hire preferences that they fall under. And that we wanted to make sure it's recognized up front that the hiring of anything that happens is going to be strictly opportunities will be there for everyone, and that it's not going to be driven by those kind of preferences. That is a subject that needs to be explored much further, as to actually do all of these. Now, the goals then that came out of this include the following. Improve access to primary and specialty services close to home. We talked about that earlier. And then attract and retain high-quality providers and staff. Create a financially thriving enterprise that enables the expansion of services in our community. And enhance patient care, quality experiences, and clinical outcomes. So as we evaluated all these different options, these are kind of the values and the goals that were underlying everything in our discussions. And I feel, for the most part, that we have met those, in these recommendations that are flowing out of this work that will be now going to our board and to the assembly. That you will see, if you look at them, that these underlying values and goals are covered in there. So let me get back now to the selective and coordinated collaboration that the consultant will be moving forward and recommending as the preferred alternative. And there are a lot of questions still. This is just kind of the start of what could be a long process if our board and Search's board and the assembly decide to move us to the next level of these discussions. There will be a lot of questions that need to be answered, and what the consultant focused on was the financial uncertainty that's coming down the road for Sitka Community Hospital and Search, changes that are taking place in how we get reimbursed from the state and the feds, from Medicare and Medicaid, from all of our various funders. The fact that Sitka is facing continuing challenges at the city level in how it's going to fund services, and the fact that our tobacco tax revenue at some point could be at risk of that the community could take a look at that as a source of changing the flow of that funding to other higher need areas in the city. And we also see a demand, for specialty providers that aren't here in town, and the fact that we have a lot of excess capacity, especially on the inpatient side, on both sides. So those were some of the factors that had gone into the direction that the consultant has taken on this, and is driving some of these recommendations. No decisions have been made, of course, on any of these, because there are lots of different options for how to achieve this kind of collaboration. But it's going to be, the way I see it is, it's going to be some kind of health delivery entity, a new health delivery entity that would be created or put in place that would have joint governance, and to make that work, there needs to be some local control. So that's the joint governance that Sitka, the community of Sitka, would have some say in that. So either ownership as well, but definitely a joint governance, so that the community still had a say in how healthcare is delivered in this community. And again, that there are just so many options. The consultant has lots of examples of this, and as we move forward, or if we move forward, we'll be looking at multiple different ways of achieving this. But basically what would happen if we're able to consolidate clinical and support services, have a shared medical staff, operating as a single healthcare delivery enterprise, we'll be able to take advantage of some of the reimbursements that Search is able to take advantage of because of their status as a healthcare entity in the tribal medical area. That could be, we think, in the area of $2 to $2.5 million. And right now, I don't understand exactly how that's going to work. We're continuing to gather information on that to make sure, because this is kind of an important area. We want to make sure we understand that and how it would really work. And of course, then looking at duplicative services and overhead savings, there'd be a lot of savings there. And then the big thing is service expansion. That's what's exciting to me, is that there's an opportunity for us to really expand what's available in the healthcare that we provide in this community, and potentially trying to get local people to stay here in town for more of their healthcare, which is good, as well as this new healthcare entity would have a contract with Search to provide hospital care for their beneficiaries. So really, we look at expanding our base population that we'd be taking care of here from the Sitka of several thousand to Search's entire beneficiary, which is another 16,000 people. And with that as our base, you really could look at expansion of services. So that's one of the areas, again, that's driving some of these recommendations. So where we are in this process now, the final report will be coming out from the consultant. I've seen a draft, but we're waiting for the final one. It should be out sometime in the next week. Our plan is to have a work session with the Sitka Community Hospital Board sometime during that week of September 25th. We're waiting to hear some dates on that right now. So that's where the consultant will be here to do a presentation to the board and to get start answering some questions and just lay out the recommendations and the work that's been done. The consultant will be doing that same thing with the Search board, but that will happen later at the Search board meeting in October, towards the end of October. And then we're looking at a date that'll work to do a similar work session with the Assembly to provide the information to them as well. I'm also going to try to coordinate with the consultants, so after they've done their presentation to the board, maybe the next day we can set up to have some all staff where we can also have the consultant do a presentation to staff, and we'll tape that and get that on the intranet as well as part of that. So we're hoping to have some word about that here very shortly. So that's kind of where we are in the process. Like I said, no decisions have been made. This is a recommendation with a lot of information and a lot of questions that have flown out of it. What we're looking to get is input now from the boards of both organizations and the Assembly, and a decision on whether to move forward to the next level of answering some of these questions and start to see if it makes sense to develop some type of process or plan to how we can continue to answer questions and see if it makes sense to put together some type of collaboration and project. So that's where we are. I'm available, of course, if you have questions. Happy, just stop by. I've got my door is open. You can stop in and ask questions. You can send me emails, and we will be doing the all staff meetings as well as managers meetings. So there will be opportunities for questions, and try to get as much information as we can. Once the board has this packet of information with the recommendations, then of course it becomes a public document, and then the final plan will be available as well for people to take a look at, as well as some of the background information. So hopefully that will help with people's questions as well. And with that, I think that covers about everything I wanted to at this time. Thanks for listening, and I look forward to trying to answer questions and talking and seeing what comes of this project. Thank you.